Minutes. So let me get back here. I'm just going to make some welcome remarks for everybody. And thank you all for being here. Again, my name is Chris Yanis, and I do the policy and advocacy work for the Methodist Healthcare Ministries. We are here today with the Center for Public Policy Priorities to share an annual report on the state of Texas children, specifically the well-being of the children in the Rio Grande Valley. All of you here are child advocates, parents, teachers, social workers, community health workers, and my Wesley nurses here. We thank you for what you do to look for our children, to look out for our children, to educate them, to heal them, and mentor them to be all that they can be. We want the State of Texas Children Report to be a new tool in your toolbox to help you start the discussion on what is reality for a child growing up in the Rio Grande Valley, and what can we do to have this child have a better life, to have the best life that they possibly can. I am blessed, my team and I are blessed, that Methodist Healthcare Ministries believes in advocacy and allows me and my team to work on healthcare policy solutions, advocating at the state level for state legislators and helping other groups organize their voice. Groups like you who want to organize and build coalitions and take these issues to your local legislators to make that trip to Austin when needed. This report is just a starting point. It does no good to throw it on your desk. It does no good to add it to that big stack of reports that's sitting there in your office. It can only have value if you take the data and talk about it, share it, organize meetings that include local leaders, and decide on next steps. That may be addressing your school board. That may be talking to your city council person. That may be making a commissioner's court meeting. Or yes, that means going to Austin and asking your state legislator, your state senator, to fix it. The data has to move to make a difference, and we have to hear about it to help. We are happy, and my group is happy, to meet with coalitions and help you organize your agendas, develop your materials, and connect with your elected officials. This is on your desk or on your tables. You will find copies of MHM's legislative agenda. These are the 5 initiatives that we just finished taking to the state legislature and advocating for them, all that impact our children, our patients, our communities, and hopefully these are the issues that impact you as well. Again, thank you for all that you do day in and day out to help our children grow to be happy, healthy, and empowered young people to exceed in this very complex world of ours. I'd like to take this time just to recognize a few folks. My team, my folks from Methodist Healthcare Ministries are sitting here in the front. So guys, if y'all will stand. These are the folks that I work with at Methodist Healthcare Ministries and who work with me. These are the Wesley nurses right here. And we love our tagline, serving humanity to honor God. Many of you know them, you work with them, you have your community grants with them. So I'm very proud that they're here to join us today. I'm just going to repeat a couple of things that Francis said. We have copies of the reports at your tables in English and Spanish. We have interpreters and headsets available for folks who'd like to hear the presentation in Spanish. We have a healthcare information table on outreach. This is the time to sign up for insurance, and we are having an awesome outreach effort and seeing that the numbers are higher than last year, which is really amazing. This event is being recorded and will be available on the CPPP website very soon, just in case others missed it. A quick look at our agenda here. So we will have Christy Tingle from the CPPP make the presentation on the report. We'll have a question and answer period following that. And then Sandra Sanchez with the McAllen Monitor will be doing a panel with Graciela Camarena with the Children's Defense Fund of Texas and Dr. Marcia Griffin, University of Texas, Rio Grande Valley. We also had Representative Bobby Guerra confirmed, but trials got in the way, and so he and his staff were very gracious, letting us know yesterday that they had to bow out. He had some trials this morning. I'd like to just go ahead real quickly and introduce you to Christy Tingle. She is the research analyst at CPPP since 2016. She works on advocacy projects, including the report that you are going to hear about today. She is an awesome graduate of the University of Texas at Austin. Go Hook 'em Horns. And she that's her master's, and she received her Bachelor of Science in Economics and an RTF, Radio, Television, and Film from Auburn University. So, Christy, I will turn it over to you, and thank you all again for joining us this morning.
All right, good morning. Thank you so much for that. Well, let me get this situated. Thank you so much for that introduction, Chris. And I also want to start by thanking Methodist Healthcare Ministries and the Annie E. Casey Foundation for the support they've given us for both this report and this event. I also want to let you guys know that we have a hashtag for this event. It's right there, hashtag KidsCount. So if tweeting is your thing, then tweet away. So like Chris said, I am from the Center for Public Policy Priorities. How many of you have heard of us before? Okay, a fair number of folks. Well, I want to let you know that Kids Count is only one of the projects we work on at the center. It's a project of the Annie E. Casey Foundation that collects data on how children are doing across the country. And through that project, we work specifically on Texas, and in this case, on the Rio Grande Valley. We look at policies also at the state capitol, and we advocate for things like training Texans to get good jobs. In addition to CCCC's statewide work, we also really want to make sure we're supporting local communities, and that's part of why we're here bringing this new data to you. In this report, we will focus specifically on Cameron and Hidalgo counties because the data is most reliable there due to the size of the populations. But that said, if you're looking for additional data by county, the Kids Count Data Center is a great place to get reliable data. I am realizing I don't have my slide clicker up here anymore, so, oh, Drew's got it. Oh, just kidding. Thanks, guys. I guess that's the benefit of having a clear podium, is that other people can let me know what's going on up here. Texas is a big state, right? And the Rio Grande Valley isn't the same as other parts of the state. And if we want to improve child well-being across the state, it's not going to be one size fits all. So that's a reason that we're here. The Rio Grande Valley has really unique challenges and opportunities for children. And that's why we took a dive into this data, and we're here today to share it with you. We're also really eager to hear from you guys in the future, and today, to help us inform the work that we're doing statewide. For instance, we've been doing a lot of work to close disparities in healthcare access, and that's something that Melissa in the back will be happy to talk to you guys about. But I just want to reiterate, we would love to hear from you both at this event and later. We have also heard so much about the great work being done here, and we're just looking to create a better feedback loop so that we are better advocates at the statewide level to keep improving child well-being. And we want to arm service providers like yourselves on the ground with strong data so that you can use this in your work. So with that, let's go ahead and dive into the data. So our vision is that every child should be healthy, well-educated, and financially secure. That means all 7.2 million of them in Texas. We've taken a look at other places in the state, and the Rio Grande Valley stands out as particularly important for exploring this data. By 2050, there are going to be 600,000 children living in the Rio Grande Valley. That's a lot of children, and their opportunities for success are going to determine the future both of the region and for Texas. The future of Texas really belongs to them, and the choices we make today will impact them. As we look at the data, we've really been exploring what every child means. What we've found statewide is that Black and Latino populations in Texas have faced structural barriers to opportunity. Particularly, these policy barriers have been put in place by people to be specifically hostile and discriminatory. But policies also don't have to be created with discriminatory intent to have discriminatory impacts. In Texas, right now, discriminatory policies are especially threatening to children in immigrant families. We know that more than half of the children in Cameron and Hidalgo counties live in an immigrant family, which means that at least one of their parents is an immigrant. For children in immigrant families, especially those with an undocumented parent, the threat of separation from families and communities is greater now than at any other time in our recent history. Immigrant families face these challenges in addition to the same challenges all working Texan families face. Instead of pulling families apart, policies can help strengthen family stability and ensure that immigrant families are able to fully nurture the next generation. So let's return to our vision. that every child be healthy, well-educated, and financially secure. And let's dive into what financial security means for Rio Grande Valley children. Median income for households with children is much lower in the Rio Grande Valley than in Texas. In Cameron and Hidalgo counties, median income, again just for households with children, is $35,750. That means that roughly half of households who have children are making less than that, and roughly half are making more than that. In the whole state of Texas, median income for households with children is about $64,000. And some people might say that this makes sense because the cost of living in the Rio Grande Valley is lower than in other places in the state like Dallas or Houston. Fortunately, we have this really cool tool that shows what families really need to get by in different areas of the state. In this case, I've pulled some data that shows what families in the Rio Grande Valley need to get by. But if you go to familybudgets.org, you'll find an interactive page that was very recently updated with new data where you can see how much a family needs to earn to meet their basic needs in metro areas across the state. You can select things like family size, how many parents are working, and if the family is saving for anything, like emergencies, college, or retirement. For our purposes, I looked at families with 2 kids in the McAllen-Edinburgh mission area who aren't currently saving for any of those things I mentioned. For a 2-parent family with 2 kids to meet their basic needs, each parent needs to make $10 an hour. That combined gives the family an income of $20 an hour, or about $41,600 a year. Since the median hourly wage here is $15 an hour, it may not be too hard to find a job making $10 an hour. But if just one parent were working, they would need to find a job that lets them make $20 an hour to make ends meet. And let's say that our family still has 2 kids, but has a single parent supporting them. That parent would still need to earn $17 an hour to get by for their families. Since half of the jobs in the area pay less than $15 an hour, it may be a lot harder to find a job with a wage that high. For a full-time year-round worker, $17 an hour translates to about $35,000 a year. Low-wage jobs also don't tend to have benefits like paid sick leave. These are reasons why a single parent is much more likely to live in poverty than a 2-parent household. The single parent just has to make more to get by. And the biggest predictor of poverty is not making enough income. That was a joke. Thanks, guys. Sorry, stats humor. So what I can tell you guys is that too many Rio Grande Valley children live in poverty. Well, actually, too many children everywhere live in poverty. We all don't want any children to be living in poverty. But I can tell you the numbers are concerning. Remember our previous family of 4 with 2 parents and 2 children. If they're making roughly $24,500 plus $1, then they're not living in poverty. But we know that they don't have enough to get by. We just saw that they need, $41,600 to meet their basic needs. So I share those numbers to show you that this number here, $24,500 for a family of 4, the federal poverty level doesn't necessarily mean that a family can meet their needs just because they're not in poverty. So that's to set up something very concerning. Roughly 1 in 4 Texas children live in poverty. So I'll let that sink in. 1 in 4 of 7.2 million. For children in the Rio Grande Valley, though, the numbers are even higher. We see 43% in Hidalgo County and 46% of children in Cameron County are living below the poverty level. Poverty is a predictor of a kid's outcomes. Children living in poverty are more likely to go hungry, less likely to access health care, and they're more likely to face educational barriers. It's not just poverty within families that affects kids, though. We looked at what child poverty looks like on a map, this one here, and we found that 68% of children in the Rio Grande Valley live in high poverty neighborhoods, compared to just 18% statewide. That's more than 3 times as likely a child here is to live in a neighborhood of concentrated poverty compared to the rest of the state. When you look at this map, the orange areas represent areas with lower poverty, where 30% or fewer of families are below the poverty line. There aren't a lot of those. Yellow represents moderate poverty, which is between 30 and 40% of families living below the poverty line. And blue represents high poverty, where more than 40% of families live below the poverty line. So this tells us that children in the Valley are more than 3 times more likely than other Texans' children to live in areas of concentrated poverty. And research has found that the neighborhood effects of living in poverty influence not only the children whose families are living in poverty, but all children who live in the area, including children who don't live in poverty themselves. Neighborhoods of concentrated poverty can isolate residents from resources and opportunities. And here, I should note that children's opportunities for success can actually be measured. That measure is economic mobility, and that's the degree to which a child's family background predicts a child's future outcomes. One thing we know about economic mobility is that racial segregation and economic segregation are strongly connected to lower economic mobility for all children in an area. And one more thing we know is that the likelihood of living in poverty for a child is also related to their family structure. There are 2 main takeaways from this chart. The first is that children across all family types are more likely to live in poverty in Cameron and Hidalgo counties than in the state of Texas. And the second is that the likelihood of living in poverty is much greater for single parents than for married couple parents. And it's the most likely for single mothers. So this data echoes what we saw earlier, that it's harder for a single parent to make enough income to meet their family's needs than it is for a 2-income family. The gap for single parents by gender is also likely fueled by the persistent earnings gap that we see in Texas by gender, which stems from low pay in jobs with high concentrations of women, and reduced earnings potential from taking time off for caregiving responsibilities, which women are more likely to do, and also from conscious and unconscious biases. So from this data, we see that place matters. Children in different neighborhoods, cities, and regions are facing different challenges and different opportunities. And policy matters too. Policies that support working families and give parents access to good jobs can help lift children out of poverty. So going back to our mission, we want every child in Texas to be healthy. And there's some good news here. Child uninsured rates have declined since the implementation of the Affordable Care Act. That's great news because it means that more children are insured, or children are more likely to be insured. Consistent access to health care begins with adequate health insurance, so this probably means that more children are getting consistent access to health care. Unfortunately, though, the Rio Grande Valley still has some of the highest uninsured rates in Texas, with more than 13% of Hidalgo County children going uninsured and nearly 11% of Cameron County children living without health insurance. Recent threats to children's health insurance are especially concerning, as 400,000 Texas children could be dropped from the Children's Health Insurance Program, or CHIP, if lawmakers don't soon take action. Approximately 8,000 children in Cameron County and nearly 15,000 children in Hidalgo County rely on the Children's Health Insurance Program as of August of this year. To find out more about our efforts to preserve CHIP, you can check out the CCCP blog, or again, talk to Melissa back there at the healthcare table. So another thing about healthcare is that children's parents having health insurance is critical, as children are much more likely to be insured if their parents are insured, and a lot of that is driven by parents who are insured through their employer. One population of adults that is particularly of interest to child well-being is women of childbearing age, or women ages 15 to 44. And I think it's easy to see why that's so important. Having access to health insurance can help improve birth outcomes by increasing prenatal care and maternal health. Unfortunately, in the Rio Grande Valley, the uninsured rate for women in this age group is still very high, much higher than across the state, with nearly half of women in Hidalgo County of these ages lacking health insurance. That's a pretty shocking number. One piece of good news that we have seen in the state is that these numbers haven't translated to increases in maternal mortality rates. We know that that's a hot topic in Texas right now. Rates are extremely high, especially across different groups. But one piece of good news is that in the Rio Grande Valley, women are actually 3 times less likely to die from maternal mortality related reasons than in the rest of the state. When we look at the data on infant health, we see that infants in Hidalgo County are at a higher risk of having late or no prenatal care than in Texas. So there we see 13.3% of infants born in Hidalgo County have late or no prenatal care, and 8.9% in Cameron County, for those of you who can't see the numbers. One interesting thing to note here is that 8.9% is obviously lower than the Texas rate of 11.5%. So that's something interesting that one of you may be able to shed some light on. I'm not actually sure why that is. If you know, please talk to me after or during the questions. But so that indicates that there may be something good going on in Cameron County, that more infants have parents or a mother who have received good prenatal care. When we look at premature births, we also see, we actually see that in both counties, infants are at higher risk of premature birth than in Texas overall. And finally, they're at higher risk of being born low birth weight. Premature birth and low birth weight can both increase the risk of physical and cognitive developmental delays. So very important things to focus on. And again, a mother having access to health insurance is correlated with better outcomes here. So the more we can help women be insured between ages of 15 and 44, the better we're likely to see these outcomes become. So a child's access to health isn't just limited to their access to doctors or healthcare. They also need a healthy diet. 30% of children living in the valley are food insecure, which means that they lack access to enough food for a healthy diet. Statewide, 27% of children are food insecure. Higher rates of obesity are often found among food insecure individuals as well, in part because low-income neighborhoods often lack access to high-quality, healthy foods. If you think about what you may have heard about food deserts, that's a good example of how this can happen. When growing children are hungry, they can experience delays in physical, intellectual, and emotional growth, so it can really affect them. And a child who is hungry also has a harder time learning in school and is a lot more likely to have social and behavioral problems. So, going back to the statement where we want every child to be healthy, well-educated, and financially secure, let's talk about education. Of all the things that go into a child's education, research shows that early childhood education can help kids have everything they need to succeed at school. Despite the higher rates of poverty in the Rio Grande Valley, pre-K enrollment rates for 4-year-olds are much higher than for children in the valley than in Texas. Here, roughly 3/4 of 4-year-olds attend pre-K. So we see roughly 79% in Hidalgo County and roughly 72% in Cameron County of 4-year-olds are in pre-K. And that's great news. That's a higher rate than the state of Texas, which is only about half. The high rates of pre-K enrollment may be one reason that educational outcomes in the valley are higher or at least relatively consistent with state numbers. Roughly 93% of high schoolers in Hidalgo County complete high school, which is, as of 2016, about the same rate as Texas. And great news, more than 95% of high schoolers in Cameron County complete high school. This is really important because completing high school makes it much more likely for a person to not live in poverty. Once you have that high school credential, you're a lot more likely to be able to get one of those good jobs that will help you earn wages that can sustain a family. But even in an area like high school completion, where we're seeing some good numbers, disparities in graduation rates are present between students who speak English as a second language and students for whom English is a native language. We actually have a new report out on the consequences of underfunding our public schools. that shows that the impact of the 2011 cuts to public education funding by the Texas legislature have been really damaging and in a long-lasting way to bilingual education. This is an issue that's especially important in the Valley, as more than half of the students here speak English as a second language, but it's also important across the state. So we really need to fix this this issue at the state level in the legislature. So if there's one thing I want you to take away from this presentation, it's that policy is critically important. Policy has shaped disparities we have seen, and the good news is, if policy creates disparities, it can also help fix disparities. Good policies at the federal, state, and local levels that invest in our kids and make it possible for their families to succeed are critical. If we don't make improvements, the cycle starts again. So we have a few recommendations for better policies for child well-being. First, we should make school funding more adequate and equitable. Providing access to quality education for all Texas children is critically important. Again, that high school credential means that a new adult is a lot more likely to earn family-sustaining wages. That's what they need to go to college. So incredibly important. And education, so much builds up along the way. We talked about food insecurity can affect how a child does in school, but even things as early as pre-K, early development, 3 and 4-year-olds, making sure they're getting the educational foundation they need. Research shows that this leads to better educational outcomes in the long term, which ultimately correlates to earning power. Secondly, we need to protect and expand access to healthcare. Protecting CHIP is critically important. We still have CHIP. Congress just has to act really soon to fund it. And I think I may have skipped over this before, but in Hidalgo County, 15,000 children rely on the Children's Health Insurance Program as of August of this year. And in Cameron County, 8,000 children. So that's 23,000 children that we're talking about. So again, this is critically important. Melissa in the back is our expert at CCCCC. And finally, we need to support children by supporting working families. Policies that help parents get good jobs, which include family-sustaining wages, benefits like paid sick days, those are critical to the well-being of Texas families. So at CCCCC, we want every child to be healthy, well-educated, and financially secure. If this data hasn't convinced you, it may be because you haven't read your whole report yet, but I have some children's voices who may also go a long way in convincing you. So I'll play that now.
I love Texas. I love Texas because it is full of love and it's full of families. I love being a Texan. But here's the thing. The child population in Texas is growing and changing. We need support. We need our leaders to make smart choices so that kids like me and me have the chance to be the best we can be. We're the future of Texas. But today, not every kid has the chance to be the best they can be. In fact, Texas is in the bottom 10 state of child well-being. What does it mean to be in the bottom 10? That means Texas kids' education, health, and safety isn't as good compared to kids living in most other states. 1 in every 4 Texas kids lives in poverty. Hundreds of thousands of Texas kids don't have any health insurance. I want a good education so that I could get a good job. Doesn't Texas want that for me too? How can Texas be a great state for business if it's a terrible state for kids? And even worse, how kids are doing differs depending on where you live. Your gender, your race, whether you're black, Hispanic, white, or many other races. And that's not right. Every kid should have the chance to be healthy, well-educated, and to pay for what they need. Do the people who make our laws understand this? Don't they know the data? Here's the deal.
Texas can do better for the 7 million kids that live here.
Every kid deserves a bright future. and Texas can make that bright future possible.
But our leaders have to make the right choices for all of us.
Kids like me and me
Want fully funded schools and healthcare.
The good news is we know there are smart things lawmakers can do. What our leaders work on shows what they care about. So it's time for all of you, that means you too, to tell our leaders to prioritize Texas kids and make smart choices so that all of us have the chance to be the best we can be. Let's make sure that in Texas, we all count!
Pretty convincing, right? I can tell you guys that all of those kids were really excited to be in this project, even though some of them couldn't pronounce words like poverty. That was a common problem, but they definitely got what we were doing, and they were shocked that kids in Texas don't have everything they need to succeed. So it was pretty cool to work with them. And yeah, thanks to MHM for also funding that video. And I should shout out Creative Action in Austin, were the kids who were helping out. With that, I think I am ready to take some questions. We will have the panel discussion, but now is especially a good time for data questions or just anything you saw in the presentation. I think we have folks walking around with microphones. We have Francis and Mia. I'm already seeing some hands.
Mia and I are racing to see who can get to the person first. Got there first.
Good morning and well done. It really highlights the issues down here in the Valley. I have a question about paid maternity leave. I didn't see that as an issue mentioned in your presentation, and I think that's also very important.
Yeah, thanks for pointing that out. Can Francis or Mia or someone shout out if we have anyone at CWP who's working on paid maternity leave or?
Sure. My name's Mia. I'm a policy analyst with the Center for Public Policy Priorities. Our economic opportunity team does work on things like paid leave. We work with a lot of national partners on that issue right now. Currently in Texas, that is very much a national issue because of just the way that politics are in the state. We are, however, very hopeful about opportunities, especially over the next year, to start working more in local communities on leave policies, especially paid sick days. So that isn't quite the same, but it's very true that those types of policies are very important to working families. If you don't have those kind of job standards, it is effectively a pay cut for families. When someone has to take a day off uncompensated to care for themselves or to take care of a sick child, that's a pay cut. And the same goes for maternity leave. So those are very important issues, and we are working on it.
Yeah, and thanks for bringing that up in the context of this presentation. I think it's a great example of the intersectionality of the child well-being and family financial well-being. One thing I see often in the economics data on things like paid maternity leave is that the fact that employers think that women may be more likely to take time off to take care of a child is one of the reasons that we see the pay gap. So it is critically important, and thank you for bringing that up.
Christy, it's a wonderful presentation, actually. Usually when someone is presenting data, like, we get lost, but it didn't happen here, so thank you very much for that.
Oh, good, I'm glad.
It was to the point. But I would like a few clarifications. One is you never mentioned the source of data. Did you guys do the primary research, or what did you guys collect the secondary data?
Sure. This is all secondary data. Most of it is from the Census Bureau in one form or another. A lot of it is from the American Community Survey. Okay. But we also pull some data from the Current Population Survey. I know I referenced some stuff from TEA as well. And online, so you may notice on the back of this, there are no endnotes. Online will be the version that has the endnotes with all the detailed sources. Okay. But afterward, I'm also happy to chat about specific things if you want to know where to find one of these.
Okay. And I have like two more clarifications, actually. I know you mentioned like Valley has a lot of premature births and low weight births. So I'm presuming like, is it because of lack of quality food, or like, what are the reasons you guys observed on that? Because I don't remember seeing that, or maybe I got lost that time.
Sure. Well, we don't do a causal inference, but we do look in the data to see, and the research surrounding the data to see kind of where folks have made links or found correlations or actual causal reasons before. And things that we know about infant health is that, yes, mother's diet absolutely plays a role. So does access to health care. That whether a mother is receiving prenatal care is definitely correlated with those latter two outcomes of premature births and low birth weight. So that's why we link those data points together, is that prenatal care can be critical.
Great. Okay. I'm sorry, I'm not going to bug you with more, but just one more question. Last
Sure.
question. I was looking at the cost of comparison, like you mentioned, like how you need like few dollars to make a living here, and like you need more dollars in other cities. But I was reading a controversial article about how things have changed last 5-6 years in the Valley, as well as other metro cities like San Antonio, and we're comparable to those kind of cities right now in terms of living conditions and in terms of cost of living and everything. I'm not just saying it based on what I saw, and because I'm also a researcher, so I do get involved in that kind of research. And so I contradict to that, but I know it's coming from ACS. And just to give a background, like we are an official census center in the Valley, so we do look at the data very well. And so I do understand what you're telling, but I've been contradicting this one because I moved in from California here.
Yeah.
And I always been contradicting the way people say, oh, here, like you can just live with $7 an hour, like $15 an hour. I said, like, no, because I've seen how the housing prices have gone up, and I've seen how the gas prices have gone up, and everything has gone up here. But I'm not, it's nothing to do with your presentation,
well,
but
and
I'm
actually,
just trying to raise a point here because people, I want you to think about it, because all the people are here to see something good for the Valley. So I'm just trying to make a point on that.
Sure.
Thank you.
And actually, I was going to say, I was kind of referring to people thinking like, oh, well, it costs more to live in Dallas or Houston is something that might be a misconception. And that's actually the benefit of our family budgets estimator, which I'm not sure if Francis was grabbing the mic to talk about or to pass to someone else. But
yes.
Okay.
So I'm going to hawk our family budgets. Can y'all hear me okay? Okay. I'm going to hawk our family budgets tool that we just released a couple of weeks ago, which is what we were just talking about and that Christy presented in the slides. So I'm the primary analyst on that report. And I'm really glad that you brought up that question, because the family budgets tool is actually designed to show, it's designed to be an argument that we use in policy discussions. So many of our leaders talk about, we want people to be able to be self-sufficient. We want people to get by on their own without having to rely on government. We said, okay, so what is the minimum amount that you need to get by in an area when you look at Section 8 housing costs? Now, we're not talking about average housing cost in an area. We're talking about what is the voucher cost for living, using that as a conservative estimate. We're talking about low-cost health plans. And so we're trying to come up with actually a conservative estimate. And so I agree that an average person would be paying a lot more in their area. And our tool is actually be able to say, even without savings or anything like that, it still costs a family between $35,000 and $42,000 in the McAllen area to be able to get by. And that's kind of the argument that we're making with that point. And it's not meant to represent average costs. Yeah.
Thanks, Francis.
Yeah.
Good morning. Thank you for your presentation. I'm Dr. Velasquez. I've been a practicing pediatrician for the past 20 years here in the area. And the data you presented about access to health care in terms of insurance rate, coverage rates is very encouraging. Over the past 10 years, dropped from 20 to 10%. That's great. What we have seen in the actual practicing arena is that it doesn't compare with the insurance coverage that we had 10 years ago to what we have right now. The model of Medicaid, which is 90% of my patients, have moved from a fee-for-service to a managed care, which has significantly impacted the access to health care to patients. It is very concerning to me that what we were able to provide in the past with the same type of insurance, now we're unable to do that. For example, referrals to subspecialists, referrals for rehab and occupational therapy, stuff of that matter that it's important for kids, especially the ones that we identify early because of the access to health, that they have insurance. We identify them that they need that help. But unfortunately, most of these companies that are managing Medicaid now are just not providing that access to health care. And it's not about the number of pediatricians that are here in the Valley, which when I came 20 years ago, it was probably 1/3 of what there is right now. But it's also the access of healthcare that the actual insurance companies are providing for our kids. And we are trying to fight from our perspective on the legislative agenda that you present, that you show in your data here, trying to go to Austin and try to explain this to our legislator, our people that are in charge of this, because this is different. This area is so different than my friends in Dallas, Houston. They don't have to deal with these issues. We do. And when a lot of these services are being cut because the insurance companies are trying to make more money, that hurts, and it hurts our kids. So if there's any way that we can collaborate with you in order to have a bigger voice, we'll be delighted to do that.
Yeah, fantastic. Thank you for sharing that. I think that really highlights some of the limitations of data. I'm a big data person, obviously, since I got my master's in economics and everything. But it can really only tell us so much of the story. And you're absolutely right that just because a child has insurance on paper doesn't necessarily mean that they're getting the adequate care. So we need to make sure that all of that's lining up. And I would definitely recommend that you check in with Melissa back there afterward.
And this is Christianis with MHM. I just want to say that everything you said is correct, but it was planned. I mean, it was a way for the state to capitate its payments for child care, for adult care. The Valley was actually the very last area in Texas that was carved out. So you got to keep fee-for-service for a lot longer than the rest of the state. But it is a way to transfer the responsibility to a managed care, to an HMO, and to limit the care and the costs that the state will bear on the program. So that said, there at HHSC, there is an oversight committee for the health plans, and this is the time during the interim that we need to provide that feedback on the quality of care being provided by the HMOs. Right. Right.
Thank you. I'm Dr. Philip Brown. I'm the Senior Vice President for Oral Health Dental Services at Methodist. So I guess you know what I'm going to talk about. All of the things that she mentioned, maternal health, low birth rate in children, poor nutrition, lack of education, all of those have implications with poor oral health. And I'd just like to know how I can help you address that issue.
Sure. Well, for one thing, if you have good sources on data on how children are doing in regards to oral health, that would be amazing. Because I'm not actually sure where to find that. But yes, I know it's critically important, and hope we can continue that dialogue.
And actually, I'm just going to jump in here real quick. I would encourage folks to, all of these conversations that are coming up are things that our legislators need to hear. We do have 2 staff members here today from legislative offices. Can y'all raise your hands? I'm going to out yourself. So you should come rush them after. Oh, we've got several more than that. You should rush them after and talk about the issues that you're bringing up. And also, please do contact us and Chris, because we are at the Capitol working constantly, and we would love to be able to work with you and take your stories.
Good morning, and yes, we do have several offices here. My name is Alex Rios. I'm the District Director for State Representative Terry Canales, and pretty much a lot of it that's been talked about is good, but as you mentioned, it's what we're doing that's going to affect these children. Now, a lot of these representatives don't make budget cuts because they want to. A lot of times it's, as they say, lack of knowledge. We don't know what are the real issues that are happening in the state. There's just so many things that they do that we don't know. So I hate to use the word hassle. But I encourage all of you to get together and come to our offices, ask our representatives, because they need to know what these needs are for our children. And so without you doing that, now this is a public elected office, so this is your office. This office belongs to you. So if our representatives are not moving, then you need to move them out. And our office is always willing to help you, and that's why I'm willing to say that, that we are willing to help you in any way that we can. I know there's several offices here that are for legislatures, representing our legislators, but we're here to help. Please educate us with this. All these pamphlets work for us, but you need to go to our office, strengthen numbers, and that's how we'll get things done. Thank you.
Yeah, thanks.
Actually, let's keep going with a couple more questions.
Sure.
Yeah.
Yeah, it's like the kids said on the video when they were like, don't they know the data? Like you take this data and you're like, there are, so many children here living in poverty. When you see the numbers and you talk about kids, like your representatives really need to do something about it.
Good morning, Catherine Diaz from RGV Focus. There was some mention earlier about, especially the kids in the video were talking about wanting our legislators to really look into funding education for children. And as the report shows that over 60% of the families in the Valley are headed by women, right, single women. And so I'm wondering if anybody in this room is working particularly in the area of adult education, especially for women.
Just quick note, it was actually 60% of women in the Valley are living in poverty, but there are a lot of families that are headed by single women here as well. So, yeah, anyone in the room? We have a hand there. It's there.
Oh, actually, I think we're getting a response.
It's more of a personal response because I am one of those women that heads the household. I have a 10-year-old daughter, and looking at this data, it kind of hits me personally because I could have been part of the lower end, but because I had access to education, my daughter had access to medical care and child care, I was able to pull out of that and finish college. And it hits on a personal level because I want the same for other families. I look at the income and I'm like, yeah, I have to make that much so I can support my household. And not only my daughter, I also have, an elderly grandmother and I have my parents. And so this hits very personal, and I do encourage and I support and I encourage our legislators to really listen because I want the best for my daughter. I want the best for all the parents and their children in here. And we really need to do something about this because he's right. The housing has gotten ridiculously high. And I was fortunate enough to not have a mortgage when I finished college. And I can only imagine how much more overwhelming it would be if I didn't have that that blessing that I had received. But I think that the income to housing ratio has gotten just ridiculous, and I don't know how other single women have been able to do it, or single fathers, at that, because there are single fathers in the Valley as well that are struggling to take care of their children for whatever reason.
Yeah,
but I just wanted to give you a personal level on this discussion.
Yeah, well, thank you so much for sharing that. I think, definitely your empathy is something that I admire and really want to echo. Like, I know probably a lot of us in this room can step back and think about how blessed we are to be where we are, but you look at these numbers and, like we saw for a family of four, 41,000 to get by. For a single parent, I think I said single parent, 2 kids, like 36,000 or something. Making that much a year is a struggle for so many people. And it's easy to see how there are barriers put in place that we need to be working on taking down at the state and local levels to make sure that people have access to good jobs and education to get those good jobs. Do we have any more questions?
Hello.
Mia?
Hello. Can you hear me?
Yes.
Okay, great. Jan Brown, and I'm with Texas Partners in Policymaking. And that group is specifically interested in children with developmental disabilities. And do you have any numbers for the Rio Grande Valley?
I am not positive. Not in this report. I think we may have some on our Kids Count data center. Let me follow up with you after to talk about where we may be able to find some of those by county.
It's just like a small, after hearing so many people speaking, like when someone said like, for the metro areas, they already know what's happening. So this area is completely different. We need to educate the policymakers. We need to educate the government, everybody about with data. Like I know you guys are doing an excellent job. So I don't know like whether it's the right suggestion or whatever it is. If some organizations who are really at the root level, if they can collect like primary data and then present that data to the legislators, then it would make a better impact than just collecting data from somewhere else because it's not being collected rightly. So it's my observation after like 12 years in the research, I see that a big gap between what the other areas have the data and like what we have. So because we have a lot of other things happening here, we have people coming from the other side of the wall and a lot of other things like which is getting involved because the data is not right. And please, when the census is coming, please encourage every single person to be counted. It's just a message. And then any other foundation or you guys can do primary research here, please, 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 please come and do it. Thank you.
Yeah. Well, to follow up on your comment about the census, thanks so much for bringing that up. One thing that we're kind of keeping an eye on is the potential undercount of the census, which is when certain groups of people aren't counted at the same rate that they need to be properly represented. And this area is particularly at a high threat for having that undercount happen. So yeah, gathering data that is correct is just as important as gathering data that we just need. So making sure that everyone gets counted in the census is definitely a big deal. And yes, also if anyone is doing any on-the-ground data collection, I would love to hear about it. I wish we had more capacity to be doing that ourselves, but we'd definitely be interested in hearing from you. Are we out of time for questions or okay, I think we're out of time for questions. So anyone else, like I said, I'll be around after, happy to follow up more. And we'll have some time for questions after the panel, so you can keep asking stuff then. Now I'd like to invite our panelist and moderator, Sandra Sanchez and Graciela Camarena. And Dr. Marcia Griffin. Thank you all so much for coming. And while they're making their way to the stage, I should plug, not only do we have that table in the back that has information on ACA enrollment, CHIP and Medicaid as well, along with my colleague Melissa, who is our healthcare expert. She's walking around right there. And she is great to talk to you about that kind of stuff. We also, back in that corner, have a whole table. Mia's back there waving at us. We have a whole table full of reports, some of which are the same ones that are on your table. So I would encourage you guys, if you want more copies of this to take to your colleagues, please feel free to go grab them back there. But we also have, I think, 2 other reports back there from the Annie E. Casey Foundation that are incredibly good reads. I didn't write them. I like them a lot. You guys should pick those up and check them out and hand them to your colleagues as well. So with that, I guess we will jump into the panel discussion. So I will go take a seat.
Thank you, Christy. I'm Sandra Sanchez. I'm the opinion editor for the Monitor newspaper here in McAllen. A brief bio. I am not a healthcare expert. I do cover a lot of different subjects, and our editorial board has a passion for the health and well-being of the Rio Grande Valley, especially our children. I am the race director for the McAllen Kids Marathon, which is in its 4th year, and perhaps that is how I got roped into being up here. We provide a kickoff mile in September and a final mile in January in conjunction with the marathon, absolutely free of charge. And the whole idea is just to try to encourage children to run a little bit every day, every week, and be healthy and establish some health baselines that they'll enjoy and continue the rest of their lives. They don't pay a penny, and at the end they get a medal. So that is one small way that the Monitor is helping to contribute, but from all this data that we saw today, we understand that there are significant issues that, as a community, that we need to work on. So what I'm hoping from this panel is that we can take a deeper dive as to the significance of some of this information, some of your concerns, and hopefully we can come up with some doable solutions, or at least some ways that we can lobby or catch the ear of those in Austin and those in Washington, D.C. Before we get started, I did want to introduce our esteemed panel. To my immediate left, we have Graciela Camarina, and she is with the Children's Defense Fund of Texas. Graciela has a long history serving in public health, working with families, schools, community partners. She's been with the Children's Defense Fund Texas's Rio Grande Valley since 2012. She has worked in a variety of outreach, administrative roles. She's in the field. That's what she does. She serves. She is with the families. She knows their concerns. She also was, in 2002, the first state of Texas community health worker, promotora de salud, to be certified by the Texas Department of State Health Services. She graduated from UTPA, and she's a mother of 3, a grandmother, and she lives in Weslaco. So welcome, Graciela.
Thank you.
We've already met Christy, and thank you for the wonderful report that you supplied today, and look forward to more comments as you give some more analysis as to how we can directly apply that information to our region. Christy has been with the center as a research analyst since 2016, and specifically works also with the Texas Kids Count. And finally, we have Dr. Marcia Griffin. She's Director of Division of Child and Family Health at the University of Texas Rio Grande School of Medicine, based in Brownsville, correct? Co-founder of Community for Children. She's a University of Texas Health Science Center in San Antonio grad. Okay. I have a long bio here. I'm trying to read it. She has a long health. Yeah. She says, don't read it all. She graduated from UTHSCA in 2003, residency in general pediatrics at Baylor College of Medicine in Houston, and also at UTHSCA in June of 2006. She has a love of serving children and families, and I'm sure that will come out in the discussion today. So welcome, Dr. Griffin. All right. I'd like to start with one part of the report that particularly was of interest to me, regarding the colonias in the high poverty neighborhoods that Christy mentioned, suffer from some of the worst health issues. These areas are isolated, separated. Families often live in cycles and generations of poverty, and it's part of our community's history, because the founding fathers, the patrons, actually separated the various worker families, and their various farm entities were separate as by design. But it's come to hurt us in modern day, correct? Christy, can you explain a little bit more about how colonias, which is unique to the Valley, are affecting, and then the rest of you jump in, the health and well-being of the children?
Sure. Well, can you guys hear me okay? Yeah. So in the colonias, as you mentioned, there are a lot of problems with regards to access to basic services. And it's easy to see how children who live in these high poverty areas, who lack maybe even sanitation resources, are going to be a lot more at risk for health issues. I know that in the colonias, often health issues are seen that aren't seen elsewhere in the country, and you may be able to speak a little more to that. But these areas of isolated poverty really kind of compound the challenges that are facing lots of children. And I think one thing that as a researcher I really wish we had was better data on children in the colonias specifically. Due to the small geographies and issues with undercounting that I mentioned, unfortunately not great data exists, but from what we have, we do know that there are severe problems in child well-being and development.
So Graciela, perhaps jump in here, because you're out in the field and you work with these families in the colonias. And Dr. Griffin, tell us exactly what you see and what's going on.
Well, thank you. Just to add a little bit more background, I myself grew up as a migrant farm worker. So as you attested to, living in migrant camps and being isolated from the rest of the community, lived that, done that. And I grew up in a colonia as well. The misconception that colonias are only undocumented families, that I just want to also get that out, because many of these families are U.S. citizen families, U.S. citizen children. And we want to make sure that we reach and they have access to health care and information. Yes, many families who live in colonias struggle. Many of the times they want to keep their families together, and they choose to live in larger farms or larger communities in the colonias to have extended family live with them, which sometimes that's not possible in the inner city or urban areas. So again, sometimes that's an issue. And families, again, they work hard. They want to make sure they can provide for their families. And lots of information doesn't get to them. So the lack of information, access to the real issues that are happening, because they hear the rhetoric, they may be hear on the news or read in a paper, but that information that's really happening with the families doesn't get back to the community who's writing about it or talking about it. So again, making sure that families who are out in the communities get that information. So our work that we do in outreach, reaching out to these families, many of the times it's the first time that they're hearing about it, that they don't get this information. Maybe they get a letter home sent from school talking about a presentation, come to the school. Well, if they don't have the transportation, they don't have the child care, if they have more than one or two children, under the age of 3, it's hard for them to do that. So they're not able to access that information. So going out into the colonias, into the communities, and I see also various people here who have done the work that I've gone out there side by side, other promotoras and community health workers that know that it is a struggle for families. It's not that they don't want to hear this information or want to get it, but it is a struggle to, one is to trust the information that's coming to them, to be able to access the information, the accurate information once they do try to seek it, and not just get pushed out a business card, call this number. They really need that support and information.
So to establish that trust, do you work with the school districts, with churches? How do you go about the outreach? You don't just canvass neighborhoods.
Not just canvassing. Canvassing is part of it, but definitely community partners is so important. And I see a lot of faces through our Children's Health Coalition here in this room as well, that our community partners, that we need to work together. None of us can do this alone. We want to make sure that we communicate and go together in a sense where maybe the food bank is doing some work and distributing food to some pantries in a certain area. Other organizations can come in and provide information, offer assistance, be part of that. So yes, it's important for us to partner up with school districts, which we are doing, with the food pantry, with the public library, recently at McAllen and Donna, and also other community organizations, including the federally qualified health centers that also have a great team of outreach and promotoras that are doing the work as well.
Dr. Griffin, UTRGV also helps to operate the mobile health clinics, correct? That help to go out into these neighborhoods. Can you talk a little bit more about that?
Yes. First of all, I want to say thank you to the Center for inviting me to be on this panel. For years, I've depended on their data because it's solid, credible data. And there's, historically down here, we've had data collected by researchers, but they're in silos, and that data does not translate to interventions and helping the community. It's like we have a lot of data on the colonias and the conditions, but it hasn't translated, for the most part, to betterment of the community. So yes, I think the School of Medicine wants to be part of the solution. We won't be the solution down here. We are committed to working with the community. And when I say the community, it's people like you, it's the community-based organizations, it's the people that represent the folks living in the colonias and in other pockets of poverty. So we have a lot of areas within cities that are just as devastated as far as economically as the colonias, but people don't want to talk about that because it sheds a poor light on their city. So it's you could see by their maps that it's distributed across. It's not just in the colonias. Let me just mention briefly a little bit about Community for Children. And Community for Children walks side by side with the Center for Public Policy Priorities. Several times a year, we bring residents and upper-class medical students down here to renew their passion for service, giving back to a community. It's not a clinical rotation, but they work in these areas, whether it's colonias or Office of Refugee Resettlement, shelters, or they're working with attorneys down here. And they work on these particular issues that the center is bringing to light with their data. This year, we had 2 groups going into the community working with Proyecto Azteca, looking in the colonias because Proyecto Azteca wanted to see if extreme substandard housing, how that affected the physical and mental health of the people living there. And that brief report is really damning on our lack of attention to these issues and how housing equals mental health. And so if it's really poor, you're going to have poor mental health. If you have really poor housing, you're going to have poor physical health. And so those statistics carried out in the areas. In addition, another group went back and went to similar areas. And in those areas, they wanted to know about food insecurity, which Christy talked about, and mapped where the grocery stores were, where they could get fresh food. They also talked about their use of healthy food. But when they looked at it and then looked at the data and did these interviews with families, it's at least 6 miles for most of them to get to a grocery store. And having transportation to get there is really important, and we don't have that going out to the colonias. So that's another big issue is that, and I really want to touch on immigration. And immigration, we have a lot of issues, and Christy has documented them beautifully. We have a lot of issues here, but immigration is probably the air we breathe down here. It causes extreme fear in our children, in our families, that they're going to be separated. And the folks that really know about this are the community-based organizations who work hand in hand with these people and the federally qualified health centers. So it's Arise here in Hidalgo County, who does tremendous work on educating adults. Proyecto Juan Diego in Cameron Park, who does ESL classes and citizenship classes, and Arise does driving classes. So it is the community that's asking for things, and community-based organizations who need our support who are providing it. There's some school districts that are also doing the same thing and being able to reach out and realize, like PSJA, realize that the key to success is educating the parents.
Okay, before we get to education, let's stay on immigration. The report did mention that over half of the children...
Can I just go back to that? I'm sorry, I kind of rambled. But the last report they did on food insecurity is 26% of those families surveyed would not leave their colonias because of the fear of deportation. And some of those families are eating 2 meals a day because they don't go to the grocery store.
Okay, so that's what I was going to get to, was half of this, according to the report, half the children are in the RGV are children of immigrants, and half of that subset are children of a parent who is here illegally. So immigration reforms, change in immigration reforms will directly affect these children. Change in catch and release, the increase of deportations, incarceration of parents as they come across the border. So how does that threat of stability directly affect the children here, their well-being in the Rio Grande Valley, their development? Go ahead.
Okay. Well, you've touched on an issue that's really one of my passions, and that is the amount of toxic stress that is placed on a child when there is fear and anxiety in the home. And we've written articles, one of them that we wrote back in 2013 that was published in 2014, Children's Lives on the Border and the Effects of the Militarization of the Border on Children. And we have growing body of research that, 20 years of research of what this can do to a child's brain. And in the early years and in pregnancy, stress hormones cross the placenta. So this kind of fear is going to affect children at a very young age. And the earlier that anxiety within a household begins, the earlier the changes or wear and tear on the body organs begin. And that specifically translates to changes in their brain structure. And so what happens then is they get to school, they can't remember things, they can't focus, they can't behave well, they're very distracted. And instead what we do is give them medicine to try to calm them down and make them pay attention. So this level of fear permeates our community.
That's startling scientific information. State House Speaker Joe Strauss recently named a task force on border health. In it, State Senator Eddie Lucio Jr. and Bobby Guetta, a state rep here from McAllen. So is this the kind of information that you need, that this group needs to get to them to explain how the physiology of stress will directly affect these children, their development, and the community overall?
Absolutely. So I think it behooves us to take Children's Defense Fund, who I have lobbied with in Austin about issues like this, the Center for Public Policy Priorities, to come together with this, with pediatricians down here to talk about how that is affecting our family. And it's not just immediate. It will change their long-term trajectory of health.
To document it. Do they know this up in Austin?
I don't know. Do the staff? Do y'all know that in Austin?
This is the first I've heard about
plenty
this
of publications about it, and so the American Academy of Pediatrics, which I'm a member of, is got 66,000 of us, and of those, there is a particular group on poverty. There's others on child abuse. There's others on immigrant health. I am the co-chair for the nation on the immigrant health. And so we've written a lot about the stress that this causes and the need for communities to come together. So it's institutions of medicine, education, and community-based organizations and our legal partners to come together to advocate for kids. So if we're not speaking it loudly enough, call me and you and I can talk and we can speak. But these three, having Children's Defense Fund, CPPP, and us here together to advocate with our news is really important. I also want to say that if it weren't for federally qualified health centers, the health in this community would be dramatically worse. And they're being cut. And they're being faced with unbelievable cuts. And all of these cuts are a direct attack on children, because that's the effect that they're going to have.
Well, and so in that vein, let's discuss CHIP funds run out in Texas in January, as we all know. Nationwide, 9 million children are covered under CHIP, 400,000 in Texas, and we just learned 23,000 in Hidalgo and Cameron counties. So if Congress does not appropriate this money, what is going to be the direct impact here to the physicians in the room, the centers, the community workers in the room, the children and the families? What's going to happen?
Well, I'd like to just, mention they're going to be left without care. Children are going to be left without access to care. Families will be burdened with the high cost of trying to get them health care if they can. Many of these families already struggle. So these are families whose income is just above the level to qualify for Medicaid, but they don't meet the income to afford private health insurance either through their employer or even through the Affordable Care Act, but we'll see if there are any changes there. So again, families themselves, children will be affected, providers will be affected, but also pregnant women who are also part of the CHIP perinatal program, those unborn babies, they'll be affected before they're even born. So again, it's very important to point out that CHIP has been a crucial role in Texas, of course, in the nation. I remember when it rolled out here in Texas, I believe it was around 2000, my two boys were part of the first group of children that were enrolled in CHIP. They were, I think, the first 30 kids, and I have two boys now, 25 and 27. So that's been a big part of my life from the very beginning until they aged out of CHIP at 19. So again, that is, personally, I know those struggles for those families not knowing how I would be able to afford care if it wasn't for CHIP, not knowing, what will happen. So again, this is the struggle right now for families that they're worried about. And I know Melissa McChesney has put together a wonderful, aside from the blog, just information to provide to the community and to families to know what will be happening next if CHIP isn't funded or funded in time.
If it's not funded, do we think we'll even see higher preterm, lack of prenatal care, preterm births as well?
Well, my guess would be yes from the data, although I don't know for sure. We would definitely find out in future data and see how that affected everyone. I would also highlight in relation to healthcare in general, it can affect a family's financial stability as well, and a child's education. A sick child is not going to be able to have everything they need to succeed in school. It all ties into everything I was talking about in the report. But I think when we talk about healthcare, CHIP is just kind of the most recent attack that we're worried about and kind of the most urgent. But when we look at these numbers and we see that, I think around like 13% of children overall in the Valley are uninsured, that's still so many children. And the fact that we just have to be defensive right now of the healthcare that we do have is very scary for children's outcomes, because I would love us to be focusing on how do we get that uninsured number to zero.
I'm hearing a lot of the advocacy that needs to happen. I'm also hearing from therapists that in particular is one group that where children tend to not get the care that they need. Prosthetics or devices that they need to assist them, children with disabilities, that there are minimum standards that organizations comply with, and they're kind of just doing the minimum. How can providers reach out? I'm hearing that there's, quote, so much bureaucracy going on. How can providers plug in? How can the community plug in to help these children and advocate for them more?
Okay, I'll take that one. Because it goes back to what Dr. Otto Velasquez said at the beginning, who is a pediatrician, and how the bureaucracy and fighting for what our children used to get. And so that's a big issue. We need to have voices on those committees in Austin, really talking about what's happening and holding them accountable. The other thing is we need to change some of the regs within Medicaid. For instance, a lot of our families don't have transportation. Medicaid will transport them to a doctor's visit. However, there's a rule that you can only take that one child and one parent. And so they don't have anybody else to take the other kids. So that's a big issue too. So at one time, what I was told is that one of the insurance companies said they were denying all speech therapy along the border because it was a bilingual issue. It wasn't really a language issue. And if we don't get those children identified in early therapy, it will change everything in school.
Wow, sorry, the bilingual part kind of stunned me as well. Switching gears briefly, Hidalgo County twice has tried to pass a healthcare district. Part of the money would be earmarked to fund indigent care, community clinics, as well as the UTRGV School of Medicine, but it has failed. The last time was over 70% failure vote. There's a lot of opposition to this. It is an issue that a lot of people don't want to touch, that a lot of people don't want to talk about, a lot of people don't want to have come up a third time. We're hearing that it might come for a vote again. Does Hidalgo County need this, and would this help healthcare issues and well-being of children here?
Well, the Valley needs this. The Valley needs a public hospital. When I have other physicians from the rest of the country coming down here, the first thing they say is, well, where's your public hospital? And then the next thing they say is, wow, we're driving around and you have a lot of hospitals for an area this size. And how many urgent care and ERs do you need? And why are the billboards all advertising for physicians? And so we have a culture of how healthcare has been delivered and fragmented on the border by cities, by counties, by, private, corporate hospitals. So that has to change. And I don't believe it can be that the people will accept that what we're voting on is that indigent dollars go to all the hospitals that are private. And that's where they would go. They're just getting more money. So until we have a real nonprofit public hospital that serves these folks, it won't pass.
Do you think a way to start that is to have an election in which you earmark the funds just for the UTRGV School of Medicine to do outreach and study and research, and then take it to the next level later?
No.
So you
We're
think
the
go for
new
the full
kid
vote?
on the block. And so we need to prove that we can be trusted and that we're putting our money where our mouth is. And so it would fail if they said, we want to give all this money to the School of Medicine. That's not going to work. We're going to have to we're going to have to really sit down and figure out what's the best for this community.
Well, Dr. Griffin, that's direct contradiction to what Dean Krause said last week when the Texas Tribune was here.
Well, we can talk. We can talk. But, the other thing I wanted to talk about, signing up for CHIP and Medicaid, is because of the administration's new policies and their rhetoric, we have a tremendous number of families that are worried that they'll be endangered because of what's called public charge. And that if they apply for what their children rightfully deserve, they will be targeted and they will be deported. And so they're not signing up. They're not going to the federally qualified health centers because Border Patrol is parked in the parking lots. They're not going to the hospitals because they're being picked up there. And so that's another really big issue here is people aren't applying for things because they're afraid.
And another thing that was noted earlier, they're not going to be counted in the census, if they're afraid of all of these issues. So very important to note that. We need to inform families. I don't like to say educate, but I think everyone is educated in life, but we need to inform them about the rights of their children, their U.S. citizen children, that they can apply and receive services like Medicaid and CHIP and WIC, and not be affected through the public charge issue. I still have those questions when I do presentations in small groups in schools. Parental involvement programs are very helpful to bring families forward, but they come forward because they want to know, they want to be informed, they want someone to trust and be able to inform them well. So when these families come forward, they're asking a lot of questions, and they're asking questions, how does this affect me? What will happen to me? Again, we're not able to answer each and every question in that form, but we are able to provide the information that is out there via experience, via other testimonials in the room that share, this is okay, this is not a problem, we can access these services, and it's not going to count against us. And we also inform them of what may count against them. So again, just making sure that the information is available in a way that they can access it and understand it and then use it.
Well, and if you don't mind, I just want to jump in and use this opportunity to highlight again how important it is that we not be passing discriminatory policies at the state or national level, because I have just been hearing story after story, both in provision of healthcare, but also in other areas like children not wanting to go to school for fear of what will happen to their parents, or accessing just other basic services. So the climate in which we're existing is extremely important as well.
Going back to Census Bureau, this actually is a topic that I grew up in Washington, D.C. My mother worked for the Census Bureau, and she actually would canvass neighborhoods. And she worked for the international group that actually brought in census leaders from other countries to teach them how to conduct census. And so every Thanksgiving and Christmas, we had tables full of people from other countries, and that's my upbringing as a side note. Understand, though, however, this year under President Trump's administration, he's thinking of greatly curtailing back the amount of money given for the actual canvassing of the neighborhoods. A lot of electronic filing is expected. How will that work in low-income neighborhoods where people do not have access to the internet, or perhaps language is an issue? Could that affect the number of counts here in the RGV?
It absolutely could. So in multiple ways. For one thing, there is people accessing the census to begin with. If they need to access it electronically and can't do so, then that will